This is Tracy with the Oasis for Natural Healing. Oh, gotta love Instagram. I don't know why this is not streaming. Uh, Lovely. Oh, here we go. Okay, so I'm actually streaming live with Instagram as well. Yay. Anyway, so let's talk. I feel like singing a jingle. Nausea, heartburn, indigestion, constipation, diarrhea. Sound familiar? So yeah, let's talk about gut issues. And because many people have them, and not a lot of people know what to do, or they run for the nearest over the counter medication. And I can guarantee you that that is not actually the way to go. So, for instance, Pepto-Bismol, okay? Let's look at the ingredients, okay? It has a lot of stuff in there, and magnesium, aluminum. It has red dyes, artificial flavors. It's got a whole bunch of stuff. And guess what the side effects are? Not so good. Lots of problems with your gut. So, like red dyes can actually cause hyperactivity. So, ADD type symptoms, anxiety can lead to headaches, can lead to gut disruption, can lead to the same symptoms that you're trying to get rid of because of all the synthetic chemicals. Okay. So, your Tums, it's aluminum, heavy metals, which can lead to headaches, can lead to mental health disorders, just to name a few. So, I hate to say it, but you're kind of poisoning yourself with some of the over the counter stuff. And this is a common thing. People have a lot of gut issues. And I actually had a patient that went to the doctor and they wound up getting all these different tests and nobody could figure out what was going on with them. They did the scopes and their gut was actually clear, but they had abdominal pain and they were nauseous and they were bloating and everything looked good. Okay. Does that sound familiar to you guys? Like, how many of you guys have gone to the doctor and your blood work comes back normal your um or your diagnostic testing comes back normal? Guys, you're not going goofy. If you have symptoms, that's your check engine light going off. And I can't stress that enough. A lot of people don't realize that it's an issue. And Western medicine unfortunately misses a lot of things. And we're going to talk about why do you have your symptoms in the first place? Why do you get nauseous? Why do you get unexplained abdominal pain or bloating or uncomfortable? And why do you have anxiety and like brain fog and all of that other fun stuff on top of it? Okay, a lot of people do. A lot of people have these, you know, mental health issues and they also have poor digestion. So some of the foods, well, actually, a lot of the foods that we have and that we eat and we think are healthy are actually very tainted. Okay. So I don't know what anybody's diet is like, but I highly encourage everybody should be looking at their ingredient list. And it was kind of interesting because I love my father, and yes, I'm ratting my own father out. I love my father, but he has this mentality. He goes, "Well, I used to eat this as a kid, and it never caused me issues." I'm like, "Well, it's causing you issues now." And what people don't realize is the same well, and I don't even call them the same products. They just have the same brand name, but they're not even the same thing that you're eating. Okay? Take bread. Now it's got like 15 ingredients in there. We're like back in the 30s and 20s and 40s, it had maybe like 3 or 4 ingredients. That was it. Some of the same stuff like peanut butter had like maybe peanuts, sugar, and salt. And now you look at the ingredient list and there's like 10 different ingredients in like Skippy peanut butter. Like, who needs all of that stuff? And a lot of it is synthetic, a lot of it is chemicals, preservatives, and a lot of it is very toxic and causes tons of gut issues. Also can disrupt hormones, throw off your pH balance in your gut, and it's not healthy stuff. So the same things that and look at your ingredient list. You can even look at ingredient lists from like way back when because they have it archived. You can actually Google search it and look it up yourself. But if you look at the ingredient list from before to now, completely different. Absolutely completely different. So some of it is our food supply. Our food supply is very tainted. There's actually over 10,000 chemicals that are allowed in our food supply, in our over-the-counter supplements, that are allowed in our makeup, are allowed in our skincare products that are banned in Europe. Okay, propylene glycol can cause a ton of gut issues. BHT, red dyes or blue dyes or yellow dyes. This is in our cereals. This is in um, our drinks. Tons of gut issues. Okay. So nausea, abdominal pain, just to name a few. Some of them, like the red dyes, have been linked to IBD, irritable bowel disease, and inflammation. Um, they have also been linked to colon cancer. So you got to look at your ingredients and what you're ingesting. If it has any type of dyes or BHT or any type of preservatives, I'd run for the hills and I would not be ingesting that. Um, so that's just to name a few. So those are some heavy chemicals, heavy toxins. Like Tums, like I said, antacids are notorious for having aluminum, which is a heavy metal in there. Birth control throws off your pH balance. I'm not, it can actually throw off your gut microbiome. And that's why women are more prone to getting candidal infections and candida infections when they're on birth control because it can throw off your pH balances. Um, Other things, chronic use of antibiotics. So can kill your good microbiome, so your good bacteria, allowing for your bad bacteria to overgrow. Plus, some of these also have some other toxins and some other heavy metals that are notorious for finding in medications. Um, when we eat too much sugar, that actually feeds the good bacteria and the bad bacteria. If you're joining, please say hello. Would love to hear from you guys. Um, but it was interesting. I had gone to a it was a like a lunch and learn type thing. And it had to do with the GI system. And it was actually by a gastroenterologist. And they were talking about the gut microbiome. And they finally actually mentioned that good, good microbiome balance had a lot to do with mental health issues because you actually have more serotonin receptor sites in your gut than you do in your brain. So I was like, "Oh my gosh, they're actually onto something and they're actually like kind of catching up to what Eastern medicine has been talking about." And they said, well, you can do the stool sample and it'll measure like all the different bad bacterias and how much good bacteria you actually have. And if there's too much bad bacteria, we can give you this medication. It is an antibiotic. And the patient, you can give this so it was basically, a seminar for a drug company that was hosted through a gastroenterologist's office. And so you can give this medication, you can give this antibiotic, and it will kill off the bad bacteria. And so far, the trials show that it doesn't lead to drug resistance. So you can keep giving it to the patient as much as you want or as many times as needed. So They didn't talk about replacing the good bacteria. They didn't talk about, like, handling candida. They did not talk about diet at all, and so I raised my hand, and I asked them. I was the only one who did this. It was very sad because I was filled with a whole bunch of other doctors, nurse practitioners, and physician's assistants. I was the only one that asked these specialists about diet. Very, very sad. And these are supposed to be gastroenterologists or learning about how to take care of the gut, and I'm the only one asking about diet. And yet these are the people that are treating your health. So I asked about diet and I said, "Well, I noticed that that's good that you're giving this antibiotic." Actually, I really didn't think that, but so I'm like, that this doesn't cause any, resistance and that the person can't become resistant to this antibiotic. But I was like, "Well, what about diet?" And they're just like, "Well, what about diet?" I said, "Well, if they keep getting reoccurring, bad gut microbiome coming back, diet can play a big, huge part in this. Why are we not talking about that?" Because if a person is eating too much carbohydrates, breads, pasta, cereals, and sugars, and high carbohydrate, won't that feed the bad bacteria and candida? And the person giving the talk said, "Well, yes." I said, "Well, why are we not talking about that in education to prevent a reoccurrence?" And the answer that I got is because most patients do not want to change their diet and they're not willing to eat healthy. So basically, we're not going to educate them. And, I hope that, well, this might offend some people and I hope not, but I'm like, well, who's the practitioner here? And what's our job to be? Okay, so not to sound goofy, but as a parent, you guys don't let your kids just do anything that they want without educating them, and things like that. Now, I get that my patients are adults and all this other stuff, but it's my job to educate. It's my job to fully explain to patients on things that they're doing that's contributing to their symptoms. Because then in the long run, if I can educate my patients properly, then they need less supplements, they need less medications, and they're going to live a longer and happier health life, right? With less inflammation, less disease, and things like that. So, why are we not educating them? I mean, ultimately, it is the patient's decision on whether they actually want to do something with the education that we're giving them, but it's our job as the practitioner. I mean, maybe I'm wrong, but I would think that most of my patients, now granted, food is probably one of the hardest things to change. So I had a consultation not too long ago with a potential new patient. And one of the things that they said was that they don't know that they're willing to change their diet. They were coming up for a whole bunch of food sensitivities, and they didn't know whether they were willing to change their diet to help their body with inflammation. And I thought to myself, you know, that's like you have all these symptoms. Why not give this a chance? And then I have to ask then, or this is just a question for you. Are you looking for a quick fix? And as much as that, that kind of stings some people and people might get offensive, but are you looking for a quick fix or do you really want to get the help? And part of it is yes, we have to be willing to change the habits that caused us to get into this mess in the first place. So I have to be willing, even for myself, like for any health, condition that I had, whether I was aware of it or not, things that I've done in the past, like smoking, like, yeah, I'm an ex-smoker. I have to be willing to admit that the things that I've done contributed to my health issues. Yes, I followed what the doctor told me and I went on birth control pill, which threw me into a mental health tizzy and threw off my gut and all my hormones big time. But I have to be willing that, yeah, even though I was unaware, that my behavior actually contributed to my health. And then if I really want health, to become healthier, I have to be willing to change my habits. And some people, which is sad, but it's their choice, are not willing to do that. And when it comes to diet, it's the hardest thing. It is so hard for people to actually do that. Now, I recommend because when you have too much carbohydrates, you actually feed bad bacteria and candida. You do. So I usually recommend, first off, a paleo diet to my patients. So it's grain free. Don't necessarily say dairy free. If you're doing raw milk and you can, in it, raw milk is best. So paleo diet, raw milk, um, getting rid of refined sugars. If you are going to like bake, for the holidays and things like that, then, coconut sugar, monk fruit, stevia, these are some really good, refined sugar substitutes. Um, but any diet high in carbohydrates can actually throw off your gut microbiome, leading to nausea, heartburn, indigestion, constipation, diarrhea, and can cause a ton of inflammation within the body. So, other things that can actually cause this are not just candida or bad bacteria, but parasites are notorious for causing this. So, and they often get missed. Even on colonoscopies, they often get missed. And they often get missed in stool samples too. So, we actually have the biggest parasite challenge in my office. So, whoever can poop out the biggest worm at the end of the month gets a prize. And you can actually look on my Facebook and Instagram page. Although I have not had anybody for the month of September, although I've had patients that say, "Oh my God, I pooped out worms." I'm like, "Where's the pictures?" Like, I get excited about seeing parasite pictures. Like, that's like my biggest thing. So, and we have a biggest parasite challenge. So, but you can scroll back through like old photos and things like that, and you can see like pictures of parasites that patients have, eliminated from their body. I've had patients that have eliminated, not to sound gross, from their vaginal canal, from their nose. Most of it is through their poop, but yeah. So parasites can come out of pretty much any orifice. So you can see some of the pictures that my patients have sent in and listen to their stories, and see kind of what symptoms they had and how much it's improved since getting rid of parasites. So, but parasites are notorious. If you have any of these symptoms, chances are you got parasites. I have not seen one person with gut issues that have not had parasites. So, one of the biggest things that I love, for the big here, and I'm going to show you, is Para One. Hang on. Actually, and I'm out of para 3 in the office. I'm waiting for an order to come in, but I love Cellcore. So Cellcore has para 1, and it's Mimosa pudica. It's one of the best supplements to get rid of the large parasites. So it actually gets kind of sticky in the gut, and what it does is it actually should be taken on an empty stomach, um, because it gets really sticky and it kind of helps to basically immobilize and paralyze the parasites and pull anything that does not belong in your gut out. And one of the best things for getting rid of tapeworms, so cestodes, which by the way, I did not realize there. Did you know that there's over 6,000 species of tapeworms, cestodes? I had no freaking clue that there was that 6,000 species. Who knew? Um, and ropeworms. So Para One is one of the best ones. I love Para Three. It's a liquid tincture. I don't have it. I sold my last one. I'm waiting for another order to come in, but I love Para Three. Para Three is actually, I think it's a staple that everybody should actually have, um, on hand because it's so versatile. Not only is it good for parasites, but I've had, patients with ear infections. So dropping some para-3 in their ears to get rid of ear infections without the use of antibiotics. I've had patients with sinus infections. So, doing like a small neti pot nasal wash with distilled water and just a couple drops of para-3, it's been good for getting rid of that. So it's not just good for parasites, but it helps when like for the flu. It helps with there's a C word that's kind of going around, infection that people are still kind of scared of, as I see people with masking up around the Chicagoland area. But it's helped patients with that and get over it fairly quickly. Um, so I would not be home without I would not leave home without para-3. Like para-3 is like a staple. I think almost every single household should have. Um, and these are really great for getting rid of parasites. So some other quick things that you can do, ginger tea is really good for decreasing inflammation in the gut and helps just support the gut. Ginger is a fantastic herb that has so many health benefits. Good for inflammation, it's yeah, really just overall health, heart health, liver, really, really good stuff. So ginger tea can really help with a lot of gut issues too. But again, we want to get to the root cause of why you have those symptoms in the first place. So while ginger might help, or aloe vera juice. So instead of turning around and running for Tums, or an antacid or Pepsid, try some ginger tea, try some aloe vera juice that can help uh, kind of calm down that stomach while you're handling the underlying cause. So again, we want to look for food intolerances. We want to look for things like parasites. Do you have an overgrowth of candida or bad bacteria? It could even be toxins. Like I said, those like red dyes, an overabundance of red dyes in your system, because if you can't detox it, it stays in your gut, it stays in your cells, and that can cause a lot of issues. Okay. So we want to get to the root cause of why you have your symptoms in the first place. There's been a ton of patients with gut issues that have been able to be helped, because who likes to be up at night with indigestion? You can't sleep, the abdominal pain is all over the place, and you just feel uncomfortable. Who wants to look like they're 6 months pregnant when they're not? So if that describes you, and you consider brain fog, brain fatigue, memory issues, mental health issues, all stems from the gut, guys. So if you want help, or you're suffering from any of these, give us a call, 708-554-6730. Have a wonderful